Hi, today we're going to be talking about how to repair a saddle nose. So a saddle nose basically means that this part of the nose, the mid or lower dorsum, has caved in, and that can happen from prior surgery, it can happen from drug use like cocaine use, it can happen from repeated trauma, which is the case we're going to be talking about today. So this lovely patient is a professional rugby player, and she suffered multiple traumas to her nose. So her nose is a little bit crooked, and we can see how there's a loss of height on the bridge and a little bit of a loss of tip projection as well. On the profile view, you can really see what we're talking about. So she has a bit more of a hump than she would like, but she's also lost some height of this lower part of the bridge. So this is a moderate saddle deformity, and this can impact breathing, but it also makes the nose look like it's been traumatized. So this is what I did during her surgery. So the most important thing when I opened her nose is I found that her septum was essentially gone. She had eroded it from so much trauma to her nose. And even the front part of the septum, which is supporting the tip of the nose, had buckled like this. So it was basically deviating to the right side, then the left side, then back to the right, almost like an S-shaped deformity of the front of the septum. So it had essentially accordioned or collapsed inwards. So what I did in her case is I had to use her rib cartilage, which was a very small incision, about 1.8 centimeters or so just about 3/4 of an inch. And it hides really nicely in the crease underneath the breast, so the scar is basically invisible once it's healed. I used that to create a replacement graft to rebuild the front of her septum, and I placed a support graft called a spreader graft on the left side of the bridge. I also lowered the height of her nasal bones a little bit and then straightened out the nose. So those were the key points. The bridge is smoother, the tip has more support. Her columella is not as retracted as what it is prior to surgery. On the front view, the nose is straighter with more tip definition. And on the base view, this is the small incision I made, and this heals to absolutely nothing. That scar will be invisible once it's done healing. These are all dissolvable stitches as well. On the front now, this is about a year out from surgery. She's delighted with the results. She's breathing beautifully. We can see how the nose is straighter and smoother with better support. She can breathe better through this left side because it's not collapsed anymore. On the base view, we can see more nostril symmetry, more tip definition, and a smoother brow tip aesthetic line. On the profile view, this is where you can see how the hump is gone. She has a slight super tip break. The tip is well supported. Here's the other 3/4 view, and here's the other profile view as well. So by keeping the nose just slightly less than straight and maintaining a little bit of that super tip break, I think that makes the nose look really cute, and it keeps it looking feminine. We can also see how the columella is not as retracted as it was before, and she's super happy, as are we. So thanks so much for listening.